process of voiding urine, and it has a reflex process. Although the micturition reflex is a spinal cord reflex, it can also be initiated or facilitated or inhibited by centers in the cerebral cortex or brainstem. The main physiological events in the process of micturition are filling of bladder and emptying of bladder. If you see the innervation of the urinary bladder, it has a sympathetic innervation and parasympathetic innervation. Sympathetic innervation, they mainly the preganglionic fibers of sympathetic nerve which are arising from the first and second lumbar segments of the spinal cord. They pass through the lateral sympathetic chain and terminate in the hypogastric ganglion. The postganglionic fibers arising from this ganglia form hypogastric nerve and supplies dextrosor muscle and internal sphincter. Stimulation of sympathetic nerve results in filling of bladder, that is by relaxation of dextrosor muscle and the contraction of the internal sphincter. The sympathetic nerves to the bladder have no role in micturition, but they mediate contraction of bladder that prevents semen from entering the bladder during ejaculation. If you see parasympathetic innervation, the preganglionic fibers of parasympathetic nerve form the pelvic nerve, which is also called as nervi erginatus, and where pelvic nerve arises from the second, third, and fourth sacral segments and terminate in the hypogastric ganglion. The postganglionic fibers arise from hypogastric ganglion and innervate dextrosor muscle and internal sphincter. Stimulation of parasympathetic nerve results in emptying of the bladder by contraction of the dextrosor muscle and relaxation of the internal sphincter. The pelvic nerve has no sensory fibers which carry. The pelvic nerve also has the sensory fibers which carry impulses from stretch receptors present on the wall of urinary bladder and urethra to the sacral segments of spinal cord. If you see somatic nerve supply, the external sphincter is innervated by the somatic nerve called pudendal nerve. It arises from second, third, and fourth sacral segments of spinal cord. It maintains tonic contraction of skeletal muscle fibers of external sphincter and keeps the external sphincter constricted. During micturition, this nerve is inhibited, leading to voiding of urine. Pudendal nerve is responsible for voluntary control of micturition. So this diagram shows the innervation of the urinary bladder, shows the sympathetic, parasympathetic, and the somatic innervation. Sympathetic innervation mainly through the L1 and L2 segment where they form hypogastric ganglion. They innervate mainly the dextrosor and internal sphincter and causes the relaxation of the dextrosor and contraction of the internal sphincter, whereas parasympathetic, which helps in micturition, arises from S2, S3, S4, forms the pelvic nerve, then relayed in hypogastric ganglion, innervates the dextrosor muscle and internal sphincter, and they causes the contraction of the dextrosor muscle and relaxation of the internal sphincter, whereas pudendal nerve, which is formed from the sacral S2, S3, S4 segment, it is going to innervate the external sphincter and it leads to contraction or relaxation or voluntary contraction or relaxation of the external sphincter. Filling of the urinary bladder. Urine is formed in the kidneys, flows through ureter to urinary bladder. The physiological capacity of the bladder varies with the age. 20 to 50 ml at birth, 200 ml at year, and 600 ml in adults. The anatomical capacity of bladder is around 1 liter. The volume and pressure changes in bladder during filling. As bladder fills up, it adjusts its tone and large volume of urine can be accommodated with minimal alteration in intravesical pressure. Each time urine flows, relaxation of the dextrosor muscle occurs until physiological limit is exceeded. A plot of intravesical pressure against the volume of the fluid in the urinary bladder is called as cystometrogram. The normal cystogram shows three important phases in the filling, that is phase 1, phase A, phase 1B, 1A and 1B, and phase 2. where in phase 1 the the intravesical pressure increases as the intravesical volume increases. Then in the phase 1b, the the pressure is going to remain constant. There will be plateau until the volume reaches up to 400 ml, from where the intravesical pressure tremendously increases, and that leads to widening of the urine. That is, it initiates the micturition reflex. In phase 1a, it is the initial phase of filling, in which pressure rises to 5 to 10 centimeter of water when about 50 ml of fluid is collected in the bladder. In phase 1b, where it shows a plateau, that is intravesical pressure remains more or less at around 10 centimeter of water for a volume up to 400 ml. The flatness of the phase 1b is manifestation of law of Laplace. Law of Laplace is nothing but P is equal to 2T divided by R, where P is pressure in the bladder, R is radius of the bladder, and T is tension on the walls. In the bladder, tension increases as urine is filled. At the same time, the radius also increases due to the relaxation of dextrosor muscles, and therefore the pressure increase is slight. In phase 2, once the volume reaches 400 ml, pressure suddenly rises, and this is shown by phase 2 of the graph, and this is the volume at which micturition reflex occurs. Note that the first urge to void of urine is felt at around 150 ml and marked sense of fullness at around 400 ml. When it is increased beyond 450 ml, pain and discomfort occurs. Emptying of bladder, that is micturition reflex. Micturition reflex is initiated by stimulation of stretch receptors located in the wall of urinary bladder. Filling of the bladder by 30 to 400 ml, 300 to 400 ml of urine in adults is the normal stimulus for micturition to occur. The sensory, that is afferent impulses from the receptors reach the sacral segments of spinal cord via sensory fibers of pelvic, that is parasympathetic nerve. The motor efferent impulses produced in the spinal cord travel through the motor fibers of pelvic nerve toward the bladder and internal sphincter. The motor impulses cause contraction of the dextrosor muscle and relaxation of the internal sphincter so that urine enters the urethra from the bladder. Once urine enters urethra, the stretch receptor in the urethra are stimulated and send afferent impulses to spinal cord via pelvic nerve fibers. These impulses inhibit pudendal nerve. So external sphincter relaxes and micturition occurs. Once micturition reflex begins, it is self-regenerative, that is, initial contraction of the bladder further activates the receptor to cause still further increase in sensory impulses from bladder and urethra, which cause further increase in reflex contraction of bladder. The cycle thus keeps on repeating itself again and again until the bladder has reached a strong degree of contraction. The voluntary contraction of abdominal muscle aids the expulsion of the urine by increasing the intra-abdominal pressure. So this is a schematic diagram showing the micturition reflex. Filling of the bladder stimulates the stretch receptors, which reaches the sacral segment through pelvic nerve and to the urinary bladder, where it is going to lead to the contraction of the dextrosor muscle and relaxation of the internal sphincter. So then the flow of urine occurs in the urethra, which causes stimulation of stretch receptors through the pelvic nerve. There will be inhibition of the pudendal nerve, which causes ultimately relaxation of the external sphincter, causing widening of urine. Higher centers for micturition, that is voluntary control of micturition. Spinal centers for micturition are present in sacral and lumbar segments, but these centers are regulated by brain. The facilitatory area is located in the pontine region and in the posterior hypothalamus. The inhibitory area is in the midbrain. Several centers located in the cerebral cortex are mainly inhibitory but can become excitatory. The higher centers exert final control of micturition by following means. The higher center keeps the micturition reflex partially inhibited all the time except when it is desired to micturate. The higher centers can prevent micturition even if the micturition reflex occurs by continual tonic contraction of the external urinary sphincter until a convenient time is present. When convenient time to urinate is present, the higher centers can facilitate the sacral micturition center to initiate micturition reflex and at the same time inhibit the external urinary sphincter so that urine